a psychosurgical technique that required psychiatrists drilling holes into someone's head in order to physically destroy the connective tissue between the frontal lobe and the rest of the brain. But even more shocking than that is the fact that the Portuguese neurologist Dr. Antonio Egas Moniz, who popularized this dangerous and morally questionable method, was granted the Medicine Nobel Prize in 1949. This gets even crazier when an American neurologist, Dr. Walter Freeman, stumbled upon an ice pick one day and realized, bet I could lobotomize people using this. Forget fancy surgical drills. If I just managed to jam this ice pick in someone's eye socket and use a hammer to break through the thin layer of a skull there, I get the job done in under 15 minutes. Why bother a whole surgical team when most psychiatric hospitals back then didn't even have an operation room? What they all had instead? That's right, electroconvulsive shock machines. So why not just zap them till they pass out, instead of hiring an anesthesiologist?
When the patient shows signs of returning consciousness, a second convulsion is administered. Usually 3 successive convulsions are necessary, but in old people a single one may be sufficient, while in a sturdy young person 4 or even 6 convulsions may be administered without danger.
This method was called transorbital, aka ice pick lobotomy, and Freeman literally used an ice pick for his first procedure on a 29-year-old woman with severe depression. You see, Freeman didn't think like a surgeon because he wasn't one. He did not complete any formal surgical training, but boy, he was a pro when it came to marketing and showmanship.
5 centimeters, 7 centimeters, and the deep frontal cut.
Freeman began traveling around the country to do this quick lunatic fix in different asylums. He set a record by lobotomizing 25 patients within one day. It's estimated that worldwide around 60,000 were lobotomized before it was fully banned, with its use persisting in some countries up until the 1980s. One of the survivors of this is a man named Howard Dully, who's still alive to this day. Unfortunately, when he was a young boy, his stepmother had issues with his behavior, and after having tried different psychiatrists who saw Howard as a normal kid, she took him to Dr. Freeman, who recommended lobotomy to shift his behavior.
I remember arriving, I believe, in the family station wagon. I was checked into the hospital. I was only supposed to go in for tests. I had no clue about the lobotomy at all. I was 12 years old. I do remember that they gave me electroshock. I think I was horrified when I was getting the shocks because they were intense and I didn't understand them. I just wanted them to stop. And then they did the ice pick procedure in less than 10 minutes. I did not know even after the lobotomy that I had a lobotomy.